Hello, I am Dr. Kaitlin Mahoney. I'm the primary care sports medicine specialist with OrthoVirginia in our Southwest Virginia offices. I am located in Blacksburg, Christiansburg, and Bluefield. OrthoVirginia is the largest multi-specialty practice of orthopedics in the state of Virginia. We have offices out here in Southwest, Richmond, Virginia Beach, and Northern Virginia. So today we will be talking about concussions, most specifically baseline concussion testing. Welcome to New River United soccer players. I know you all got the invite for this, so thank you for joining us. And anyone else who's joining and interested in concussions, I'm just going to talk a bunch about different things that we do and why this is important. And then at the end, we'll be able to answer any questions that you may have. Getting back to OrthoVirginia, you can go to our website, www.orthovirginia.com, if you are looking for any providers. All right, so concussions are a hot topic. They're very common. They happen with falls, sports, car accidents. Gosh, there's a lot of different ways that they can present. There's a lot of, confusion. There's a lot of anxiety surrounding it. So hopefully we can talk about it a little bit today and if you so happen to experience a concussion. So we think approximately about 3 million concussions happen per year through sports. A lot of concussions present into the emergency room. There's constantly changing literature on what we should do. Should we continue to play? Should we stop playing? Should we rest? Should we be in a quiet room? Do we need a CAT scan of our brain? So now the athletic trainers on the sideline and parents and coaches do know a lot more. We are doing a good job at screening and getting out of practice, but there's a lot of uncertainty on what are the next steps, when can we get back to play. So when you come to my office, whether the concussion's from a sport, a car accident, whatever, one thing that I start with is an impact test. So an impact is a neurocognitive test. It takes about 30 minutes to complete. It takes you through a series of different tests. First, it starts with symptoms. So it asks you, how are you feeling? How are you sleeping? Are you sad? Are you irritable? Do you have a headache? Are you having light sensitivity, noise sensitivity, all of these things? Then it will take you through pattern recognition. It will show you different colors to match things, throw you through a lot of different tests, and then come up with a series of scores. So it will test your verbal memory, your visual memory, your reaction time, and your impulse control. And it will give you a score that is age matched for your group, your gender, specific to you. So a baseline test is something that you can do on your own time before even having a concussion. So take this test in your own home, in a quiet room. If you have 30 minutes to spare, you can get your scores on your best day. So this is really helpful to us because there's a lot of data that tells us that on a regular day, some of us are walking around meeting concussion criteria in terms of symptoms. So if you didn't sleep good last night, if you have a headache on a normal day, if you get car sickness, all these things, it's good to reflect on those symptoms and note that in your baseline. And then also see how you would do on this test on your ideal day, so that if you come in after a concussion, we have your scores after the concussion and can then go back and look at your baseline test. It's not necessary. It's not 100%. We don't need it. We do it all the time without a baseline. But if you're an athlete, especially in soccer, where it's super common to get a concussion, if we have this data for you, it takes all of the anxiety about seeing the test for the first time, not know what's coming, trying to guess what your typical score was. So that's just something that kind of wanted to make you aware of. We will provide the link on where you can get access to this baseline test. Again, it only takes 30 minutes. It's a difficult test. It's really hard to do, but it will give us great data. And then you know a little bit about what we're looking at. So other things about concussions. After we have this, this is not the only thing that we look at. So if you are worried that you have a concussion, you can't take this test on your own and be like, nope, I have it. Yes, I do. We have to be able to look at your scores, be able to talk to you, do a physical exam, and kind of look at all of the different ways that concussions can present and how are you presenting. Margaret has a slide for us that kind of shows us the different pathways that concussions can clinically present. So everyone who classically thinks of a concussion always thinks about the post-traumatic migraine. So do you have a headache? Do you have light sensitivity? Do you have noise sensitivity? So that's just one of the pathways. Some people, they just have neck pain, really stiff neck. That's it. That can be a concussion. That can be pretty debilitating. There's another pathway that we know about that's just anxiety and mood relating. So debilitating anxiety. Why do I feel this way? Why am I so sad? That happens to a lot of people who are concussed. And then we have vestibular. So are you dizzy? Do you feel lightheaded when you stand up? What about ocular? Are you having trouble looking at your test during school? Are you having trouble focusing on your phone? Things like that. Or cognitive fatigue. Are you getting headaches at the end of your workday that can't be explained? So I just think that it's important to see this, to know that not all concussions are one type of concussion. You might have a concussion and present some entirely different way than your friend who had a concussion, even with the same injury. Some concussion statistics that could be helpful to be aware of. It's estimated that 50% of concussions continue to play even when they show concussion symptoms. So especially if it's a big game, that number can go higher. What else? Girls are more likely to suffer from a concussion than their male counterparts. Soccer is the third most common cause of concussion in high school sports, and that's specific to girls. So yeah, I mean, personally, I've suffered from multiple concussions in my life. 2 were in high school playing lacrosse. One, the most severe concussion in my life, was actually hours after donating blood. I donated blood, went to go study in med school, stood up, fainted, had such a bad concussion that I was struggling with getting back to my med school task for probably weeks. And at that time, I didn't know where to go. I didn't have a concussion specialist, and I just knew to rest. So by seeking out someone who specializes in concussion, they can help you validate the symptoms that you're experiencing, but also put you in the right pathway. Do you need to go to a vestibular therapist? Do you need to modify the work that you're doing? What accommodations should we be asking our teachers for? Or are you great? Is it just you got hit? Unfortunately, you're okay to get back to sport, and then we can show you the return to play progression or the return to work progression. Let's say you need to do a lot of heavy lifting for work. What can we do to work with you to get you back to going to work? And that's something that we do frequently in our office. It's a lot of conversation. It's a lot of coming up with a plan with a parent, athlete, someone who has to go to work, working with your employer, seeing what resources are available. And then we also have PTs who are excellent in our offices who are trained in vestibular therapy, ocular therapy. Do we need to talk to the eye doctor? All these things are really important to consider. And hopefully learning about this makes you feel assured that if you do have these concerns, your concerns are valid and we can help you out. If there are any questions, feel free to write them in the chat box.
Thank you, Dr. Mahoney. Our first question is, what does vestibular mean?
So I think the easiest way that we can kind of tie it back to a lot of things that people have heard of before is vertigo. So vertigo is one way that the vestibular system can become messed up. So people know, like, oh, I'm dizzy all the time. I feel like the world's spinning. It's slightly different from the effect that you can have from concussion, just because of the way that it's caused and what is actually going on, but it is a similar symptom. So some people after concussion have a really difficult time anytime they turn their head getting symptoms. Maybe they can't go in a car because of it. if they have to play a sport where they turn their head a lot, like lacrosse, soccer, basically any sport, they're going to have a hard time until we get to calm that down and desensitize those symptoms. And sometimes that just requires some rest for sport, but sometimes we do need to send these athletes or patients to vestibular therapy, and that can be incredibly helpful.
Thank you. So what is vestibular therapy and what is ocular therapy?
There's a lot of overlap between the two of those things. A lot of times our physical therapists have to get special training in this. There's a couple of tests that we do in the office that kind of pick up on this dysfunction. So a lot of them revolving eye tracking with head turning, seeing where your eyes are able to focus or converge. Is one eye skipping around, unable to focus? There's a lot of things that we look at, and we're able to work with the therapist to pick up on what is triggering this and what we can do to desensitize this. So, for example, if someone is having trouble focusing while also turning their head, and that's triggering their concussion, the therapist can work through activities related to their sport, which are gradually working their way back into that activity without getting symptoms. It is pretty complicated. That's why it takes people who are especially trained. But again, not everybody needs this sort of treatment, but it is out there, and it does really work for people who need it.
Thank you. Someone says the kids don't want to be told that they can't play the sport, so they often don't admit to having a head bang. How do we convince them that they need to?
It's really true. It's really unfortunate because there's a lot of pressure being an athlete. You don't want to let the team down. There's a lot of pressure riding on the game itself. It's fun. And it's kind of scary to be like, hey, I got hit. What comes next? I think it's really important to realize and to understand that if you are concussed, you're slowed down. You're not going to react the same way. You're not going to be as quick. You're not going to be able to take a hit and respond the same way. And that could put you at risk of a second concussion or even another musculoskeletal injury that you're just not aware of because you're not at the top of your game. And if you do go play through these things and we're not giving ourselves the appropriate rest, then that could prolong your symptoms. And ultimately, that's not good for the team, and it's not good for you as an athlete either.
Thank you. If someone doesn't play school sports, but they just play on a rec team, are they still at risk for a concussion?
Yeah, absolutely. You can get a concussion just walking down the street. The reason why we use the baseline testing for athletes is because they are at higher risk. They're putting themselves out there of collisions more frequently. But most of the people that we see in the office with more severe delayed concussions that are impacting their life are not from sports. They're from car accidents and other things that really they don't have the trainer or the coaches or the friends who are around them to be like, hey, you're not acting right. And it's less likely to be picked up and sent in for treatment. So yes, you can get a concussion doing anything.
So if concussions also come from non-sports things, do you recommend that everybody do the baseline test just in case, they fall off a ladder or something?
I mean, you could. Unfortunately, we kind of have to do them more frequently. So a lot of schools would do it like twice within the high school year, like every 2 years. It definitely is helpful. If you're in a high risk job, I would recommend it.
Thank you. If I hit my head, but I don't think I have any symptoms, should I still be evaluated for a concussion?
Yeah, I mean, it's really hard for you personally to assess if you have a concussion. It's really hard for a parent to assess if you have a concussion. It's a good idea to just talk to your primary care doctor or any healthcare provider who's trained in concussion that you are established with, just to make sure. Because not all things are cut and dry. You could just be having anxiety or just be having a little bit of dizziness, and that stuff has to get picked up and appropriately treated, or it could lead you to a retracted recovery. And could really lead to some disability if we're not on top of it early on.
What should parents continue to look for after concussion and return to sport as a child denies further symptoms because she wants to play the sport?
Just not acting themselves, not sleeping enough, having trouble sleeping, sleeping too much, being tired. You'll see grades could potentially decline, getting behind in schoolwork, mood changes. If you're watching them play and they just don't seem like they're playing right, they're slow, their reaction time goes down. It's oftentimes it's a lot of little puzzle pieces that we put together and we're like, oh, that all makes sense, they were concussed.
Someone asks, does it matter which device I take the test
on? So there's two different types of ways that you could take them. One is with a trackpad and one is with a mouse. But as long as you have good internet, it should be totally fine either way.
So it's not designed to be taken on your phone?
Not on your phone. It would be really hard.
Can I go to school or work when I'm recovering from a concussion?
Everyone is a little bit different. Some people need a few days off. When I say a few is the key, because we do want to get you back closest to your routine as soon as possible, because there is benefit to doing that. And same with school. So sometimes we just need a day or two of rest and we can get back, but some people really do need accommodations. Maybe they need extra time. Maybe they need breaks throughout the day. There's a couple of different things that we could look at after assessing you to see what would be appropriate for you.
Thank you. In soccer, how helpful is the headgear?
So there's probably a lot of research out there that goes specifically into this sort of thing. A lot of people will be like, well, duh, soccer causes concussions because everyone's hitting the ball on their head. But it's actually a lot of the concussions are coming from collisions that are, or even non-contact, somehow falling onto the ground, hitting your head onto the ground. So there's a couple of situations where potentially headgear wouldn't protect you, or it could. That's a hard question to answer because the literature is all over the place with that sort of stuff.
How can I, as an athlete, reduce the risk of a concussion?
So we can say with confidence that if your neck muscles are stronger, you're actually able to control your body a little bit better in the sense of a concussion. So one of the reasons why we think girls suffer from concussions more is because they're smaller and their neck musculature isn't as well developed as someone who's trained to play football and they're taking hits all the time. So potentially strength training would be super helpful, making sure that if you need glasses, you're wearing your glasses. Just paying attention, getting appropriate sleep at night. It's never a good idea to be, sleep deprived and stressed and thinking about other things and then going out on the field. So just taking care of yourself, making sure you're eating healthy, sleeping enough.
Thank you. And everyone, please make sure you're putting your questions into chat. Are there minimum ages you'd recommend take the baseline test?
So the standard baseline test starts for age 12 up and through age 80, actually. There is a pediatric test, but that's kind of difficult. It's a little bit different to administer. So I don't think that you would be doing that on your own. That would be more of like an in-office type of situation.
And I think you mentioned this, but can you expand a little bit? If somebody has not taken the baseline test to compare against, how do you score them in the office when they take it for the first time after they've had a concussion?
Sure. So if someone has never taken it before, there's no need to worry. We can totally evaluate you without the baseline test. We would just use your first test after your concussion as your baseline. And basically they provide percentages comparing you to your peers, so people who are in your demographic, and then we use that combined with your history that we take, like what type of student are you, things like that, and try to put together, do we think this is impaired from your normal? And then at your first follow-up, if that's necessary, and second follow-up, we're able to trend for improvement. And then at the end, if after you recover from your concussion, then we can determine, hey, maybe it's a good time to get a new baseline for you.
Thank you. Are concussions only from head hits, or also if you get like whiplash in your neck?
That's a good question. It does not have to be your head getting hit. It could just be the impact from a concussion. Sorry, the impact from a whiplash situation.
Okay, thank you so much, Dr. Mahoney. Would you like to close?
Thank you so much. Again, you know where to find us, OrthoVirginia.com. Share this with your friends if it was helpful at all. And we're happy to see you if you have a concussion and you need us. Stay safe.